Neevita Narayan. I'm an audiologist and speech therapist. I've done my studies from All India Institute of Medical Sciences, New Delhi. Having a 22 years of experience in this field, having worked at various hospitals across the country, Apollo Hospital, Hinduja, Moolchand. Now I've set up my own center, which is running for last 9 years in the name of Sphere Speech and Hearing Clinic. I've been trained on cochlear implants in Australia, and at various other institutes. We have been traveling across for various workshops, conducting training programs in the field of deafness. I'm very passionate about treating children with hearing impairment and any type of speech disorders. I like to see them going happily to normal school and performing better than normal children having this disability. They are setting examples for me, and they are the brand for me.
An early hearing assessment of a baby is very important. Please share your views.
Well, hearing the incidence of hearing loss in India globally is 1 in 1,000, which is very high. And hearing loss is a hidden disability. If you have a loss of vision, it is picked up immediately because the child or adult cannot see. But if you have a hearing disability, it's never picked up. And so it's very pertinent for every child who is born to undergo a hearing screening. We are running a hearing screening program at Apollo Hospital, New Delhi, and also in Noida. So every baby who is born should undergo a hearing screening, like thyroid screening, lots of other screening that happens. Similarly, hearing screening is a must.
What exactly happens in a hearing screening?
So there's a very simple test wherein a probe is put in the ear of infant, and in 5 minutes we come to know whether hearing is normal or not for that baby. So that's a must. In a developed country, every baby born undergoes that test. Here, unfortunately, the government level, the program has not started, but at private hospital, it's prevalent and it is happening. So, and we are very much a part of those programs. So, hearing screening is an important factor because unless the child with a small baby will never say that I can't hear. Even a baby has mild to moderate loss. And if this loss can constitute to delayed speech, because if he will not hear properly, he cannot speak. He will never get his own voice. He will never get the environmental voice, and he will not learn to speak. Why babies are not speaking when they're born? They are speaking when they're 2 years old, because speech is a learned process. But hearing is a sense. Like vision is a sense, hearing is a sense. So if one sense is not functioning properly, it also affects speech, unfortunately. Because of vision, nothing else is affected, but because of hearing, speech is affected. And if speech is affected, if the child is not speaking or is unable to hear and speak, then we call them deaf and dumb. They are not dumb children, they are only deaf children. And that can be 100% treated. It's a matter of building awareness to parents that they should not ignore it. Because if they ignore it, there can be a grave situation. And it can be hearing, we can treat at a higher age also, but we cannot teach them to speak. Because to learn to speak and language, to develop language, there is an age. There is a critical age. And that is 0 to 2 years. So that is the time between 0 to 2 years a brain is developing, a child's brain is developing. So the speech area, the language area is also developing. The neurons are getting developed. And in that period, the hearing has to be given. If that is missed, then there can be a permanent damage always or delay always. And that can be a dangerous situation.
What are the options available if a baby is diagnosed with a hearing loss?
So if a baby is diagnosed with a hearing loss, depends on how much is the hearing loss. Say 1 month old, the thumb rule is 1, 3 and 6. We call it 1, 3, 6 goal, in which by 1 month we screen the baby By 3 months, we diagnose the baby, how much is the degree of hearing loss, and by 6 months, we put the baby for speech therapy. That is intervention. I'm using the word speech therapy because that is the most commonly understood word, but it is basically language program. We start stimulating the baby not only for hearing but also for speech, because we understand as speech and language therapists that if the baby is not hearing, he will not listen naturally, and with a device the baby has to be stimulated even for speech and language, so that by 2 or 3 years he is age appropriate. So the treatment option varies by the degree of hearing loss. So by 3 to 4 months we would know how much is the hearing loss. And if it is mild to moderate, we treat these babies, we fit a hearing aid in these babies. If it is severe to profound loss, we do fit them with hearing aid initially and start working with the child, but we know that the long-term treatment for these children are cochlear implants. Because with severe to profound deafness, a hearing aid will have a limitation. It will not cover a complete, it cannot give a complete amplification. A child's brain is required. So there is a further intervention, and that can be done by 10 months or by 12 months of age. Because cochlear implant is a surgical intervention, we have to wait till that time.
What is a cochlear implant?
So cochlear implant is a intervention to treat severe to profound children and adults. If any child or adult is diagnosed with severe to profound loss in both the years, that is the only option they have. That is a complete option, in which cochlear implant has got two components. One is the implanted component, another is the external component which is called sound processor. It looks like a hearing aid. So the implanted component is implanted by the cochlear implant surgeon, wherein the electrodes are implanted in the cochlea. Cochlea is the hearing, the sense organ in a human body. So instead of natural fibers or cells, those electrodes function. And the external component is switched on by audiologist, wherein the internal and external work together to give a hearing sensation to the child's brain or adult's brain. Say if I get deaf tomorrow and I have a severe to profound deafness and hearing aids have a limitation to my hearing, then I may be a required candidate for cochlear implant. Similarly, if the baby is born with deafness, that is more critical because the baby has to also learn speech and language. So it is very important or mandatory that we start the treatment as early in baby's life, and that can be as early as 10 months if we implant the child. If otherwise the physical fitness the baby allows, then the child can have a complete hearing by 10 to 12 months. And then that will allow the access to speech sound, and then the child can hear complete speech and can develop full language. We have lots of children at our clinic who are going to normal school, who have been implanted by 10 to 12 months, are going to normal school, and I'm very proud to say that they're doing better than normal children, being a profoundly deaf children.
Would you like to share something with our viewers?
Yes, I would like to say that if any parent discovers that the child is not responding to any type of sound, even to the very loud sound, they should not panic. They should get the baby's hearing assessment done. The audiologist available, competent audiologist. We are very much based at Lajpat Nagar, which is one of the central Delhi, Lajpat Nagar 3. And our phone number is 4608-5246. And my mobile number is 9810511246. And my phone is 24/7 available. Or if they can drop in a message, we will get back to them. So first step is to get their hearing assessment done. Any speech delay also. It's a protocol now that any kind of speech delay, we get a hearing screening done. Because many a times we have seen that we are treating them for speech and they have an underlying hearing problem. So hearing test is a mandatory for any speech delay. Otherwise also all the babies born are getting screened. In case any child is missed, or even a child has gone through hearing screening, parents have forgotten the test because at the time of birth they were not made aware of, any delay in speech or any type of ignorance to the sound should the children should be brought to audiologist for hearing test. And then we can take it further from there.
With this, we come to the end. Thank you so much for your valuable time.